Ever feel like your doctor and pharmacist, aren't quite on the same page? Like they're both focused on your health, but it's like they speak totally different languages.
Yeah, it's a disconnect you see pretty often, unfortunately. And it really gets at something crucial that healthcare we're digging into today, the whole idea of teamwork, but like really effective teamwork.
Right, and not just any teamwork. We're talking interprofessional education, IPE. Like imagine your entire healthcare team all on the same wavelength from the start. That's the dream. And we're looking at some fascinating research today, all the way from the United Arab Emirates, about how training future doctors, nurses, pharmacists, everyone, to work together from day one can get amazing results for patients.
And what's interesting is IPE is still relatively new in the UAE. So this research gives us a glimpse into what early IPE interventions can achieve, especially in a system where it's not already ingrained in the culture.
Yeah, a fresh perspective. So this research is from, let me get this right, Mohammed bin Rashid, University of Medicine and Health Sciences, MBRU for short. They're in Dubai doing cutting-edge IPE work. And they used this survey called the RIPLS to figure out how ready these students were for interprofessional learning. Like, imagine a how good are you at teamwork quiz, but specifically for healthcare.
Exactly. They were looking at how students' attitudes, their whole mindset, changed because of IPE. So they tested them before and after a specific IPE session to see if it made a real difference.
Okay, so what this IPE session actually involved? Did they just lecture students about teamwork or what?
They wanted to make it real, applicable. They based the session on what's called situated learning theory. Basically, it means making the learning environment feel like a real-world situation. So they used these two case studies, super realistic, to get students from different healthcare fields working together. One was about pain management, and the other focused on stroke.
Intense. Throwing them right into it. What kind of impact did that have?
They looked at three main things: teamwork, obviously, then professional identity, and roles and responsibilities. When it came to teamwork, this IPE intervention was a home run. Scores shot up after that session.
Wow, seriously. Just from that one session, students were more gung-ho about being on a team. Tell me more.
Oh, totally. And here's where it gets interesting. The study found that at first, the medical students, they approached the case studies very technically, very clinical.
Well, yeah, future doctors, right. What about the other students?
Right. But the nursing students and the pharmacy students, they brought up all these other essential things: communication, empathy, treating the patient as a person, not just a case. It really opened the medical students' eyes.
So it wasn't just about working together, but about understanding what good care really means. That's huge. Wow, talk about a wake-up call for those med students, right? It's like they suddenly realized, hey, there's a whole human side to this whole doctor thing.
Yeah, for sure. And that actually leads perfectly into the second thing they looked at: professional identity. You see, IPE helps students really own their roles, feel confident about what they bring to the table.
It's like instead of just, I'm a nurse, it's I'm a nurse and my perspective matters.
Exactly. And in this study, nursing students especially felt that shift. The IPE made them realize how much their expertise, their focus on the patient's well-being, all that, was crucial for teamwork and good care.
It makes you wonder, if we're aiming for truly integrated healthcare teams, everyone in sync, should this kind of training, seeing different perspectives, be like mandatory for all healthcare fields?
It's a huge question right now in healthcare education, especially with how complex patient care is becoming. And this study, even though it's a starting point, it shows how powerful it can be to expose students to different perspectives early on. It's not just about how they view teamwork, but how much they value their own role in it too.
Right, because when everyone gets each other's roles, they're going to communicate better, right? Less chance of those misunderstandings that could be, actually dangerous for patients.
Absolutely. Yeah. And that brings us to the third thing they looked at: roles and responsibilities. Now, this is where it gets interesting because remember how much teamwork and professional identity improved.
Yeah, way better.
Okay, well, defining exactly who does what, that was trickier. Students still had some uncertainty about that, even with the boost in teamwork and knowing their own roles better.
So even though they felt better working as a team, they were still a bit fuzzy on the specifics when it came to real-life situations.
Exactly. And healthcare, it's just complicated. So many moving parts. This IPE session, it was great, a solid first step. But that deep understanding of everyone's roles and responsibilities in all kinds of situations, well, that takes time and lots of exposure.
It's like learning a new language, maybe. You get the basics, but then there are all those little nuances. You can't cram it all into one lesson.
Right.
even if it's super realistic.
Right, and this finding is so relevant because even in the UAE, where IPE is still fairly new, they're already bumping up against this.
It's like they're trailblazers, kind of. Setting the stage for more collaboration, but realizing there's still a long way to go. It's kind of like they're figuring it all out in real time and everyone's watching.
Yeah.
But it does make you think, what does all this tell us about where healthcare education needs to go next?
That's the big question, right? This study, even though it's just one study in one place, it gives us some clues about what IPE can do, but also the challenges, like even a short IPE session, if it's done right, it can change how students feel about teamwork and how they see their own roles. But then really getting those roles and responsibilities down pat, that's going to take more than just one session, no matter how real you make it.
Yeah, it's like, okay,
Yeah.
so you're building a house, right? You need that foundation, the teamwork, everyone understand each other, but then you got to build the walls brick by brick. That's like the constant learning, working together over time.
That's a great analogy. And that's the challenge, but also the exciting part. How do we make sure that learning keeps happening, that students and even healthcare professionals already out there get those chances to learn from each other, to really get those roles down? It can't just be a one-time thing, you know? It's got to be part of how we do healthcare education, period.
Which brings us back to, well, you listening right now. Think about your own experiences. Ever feel like, wait, shouldn't my doctor and my pharmacist already be on the same page about this?
We've all been there, right? And as frustrating as it is, sometimes those experiences are what make us push for better. Because let's face it, healthcare is only getting more complex. Having everyone on the same team isn't just about things running smoothly, it's about patients getting the best care possible. And, it's about patients feeling empowered to speak up, to make sure everyone's on the same page.
So true. So as you're thinking about this research, thinking about your own experiences, here's one last thing to chew on. This study, they looked at what happened right after that IPE thing, right? But what about down the road? You think this kind of experience, learning to work together, really seeing other professions' points of view, you think that sticks with those students once they're actually out there working?
That's the million-dollar question.
Yeah.
If we want IPE to really transform healthcare, we got to figure that out.
Yeah.
What's the long-term impact? Does it change not just how these future doctors and nurses work, but how they lead? Do they fight for that collaborative spirit wherever they go?
Big questions. And on that note, we're wrapping up another deep dive. From a university in Dubai all the way to the future of healthcare, we've covered a lot. Teamwork, those tricky roles and responsibilities, and just how much potential there is when healthcare professionals really work together. Thanks for joining us.